Good afternoon, Dr. Polson. You're welcome to start with the webinar.
Good afternoon, everyone. I am so excited to be a part of this series of webinars in celebration of Youth Month. I am Dr Helet Polson, the Gauteng North Branch Manager of the South African Association of Pediatric Dentistry, or SAAPD. We, the SAAPD, in association with SADA, the South African Dental Association, are joining hands in this webinar series aimed at you, the general public, to promote children's dental health in celebration of Youth Month. We, the SAAPD, are an association dedicated to promoting oral health and general well-being in children all around South Africa through various different initiatives. Today's topic is thumb sucking and how to dump the dummy. I'm just going to share my screen with you guys. Give me a moment. This is a question I'm frequently asked in my own dental practice. And today I would like to discuss thumb sucking and pacifier use in infants and young children. Sucking behavior in babies is a natural reflex. This is firstly to enable them to feed, be it breastfeeding or bottle feeding, and secondly to soothe. It gives them comfort and makes them feel secure and happy. We often see it on ultrasound images as well, of babies sucking their thumbs in the womb. So thumb sucking is perfectly acceptable for infants. It's a natural reflex. It can often be seen in the womb during development. It gives your baby comfort. It's a coping mechanism when they are anxious or separated from their parents, and it helps to induce sleep. Regarding pacifiers or dummies, the use of a pacifier or dummy is common amongst infants in South Africa. And contrary to popular belief, we as dentists are not opposed to the use of pacifiers, as it can help toddlers to self-regulate and to self-soothe. And sometimes we as mummies, and yes, I'm a mummy as well, need some time to ourselves and give us a break from a crying baby. There are, however, some risks associated with dummy use. Some risks if a dummy is used incorrectly, and also if used for a too prolonged period. So in this slide, I would like to discuss the do's and don'ts if you decide to use a dummy. Firstly, select the correct size. A too small dummy can pose a choking hazard, and also regularly inspect the dummy to make sure that there aren't little bits of pieces coming off. This can also be a choking hazard, especially in small babies. Be careful with straps and cords, as this can be a strangulation risk. Dummies are sometimes associated with otitis media or middle ear infection. And it is recommended that if your child suffers from this, to limit the use of dummy or to stop using the dummy, as this can, research has shown that this may reduce the risk for middle ear infection. Then there's a risk of cavities. And this is when a dummy is dipped in honey or sugar. We strongly suggest that we do not do this. Dummies are also a growth area for bacteria and yeast, and can give a baby yeast infections or bacterial infections. So especially in newborns and young children, it is important to sterilize the dummy. And then dummies are fine if used in infants and young children, but dental problems can become an issue if used after the age of 3. Which brings me to, what harm can a dummy actually do, and how does this affect the development of your child's face and teeth? Using a dummy after the age of 12 months may lead to the development of what we call an anterior open bite. What this is in layman's terms is the teeth in the front will not be opposite each other. So the dummy places pressure on the front part of the upper jaw. This prevents the jaw and the front teeth from growing forwards and downwards. And the result is that when your child bites down, the teeth are not touching each other in the front. And this can cause difficulty in speech, as they might develop a lisp, and they won't be able to bite through a sandwich. So it can cause difficulty when eating and normal function. This will, however, normally close, the gap will close naturally if the dummy use is limited or stopped by the age of 3 years old. So although this happens after the age of 12 months, it will still correct itself in most cases if the dummy use is stopped by age 3. Another one is a posterior crossbite. So posterior is at the back of the mouth. So this is where the back teeth are biting the wrong way round. It's a narrow upper jaw, and instead of the upper teeth biting over the sides of the bottom teeth are now biting over the sides of the top teeth, and this further limits the growth of the upper jaw. And this may cause orthodontic problems in future. It can also relate to speech problems. So therefore, important to ditch the dummy by age 3, as most of these problems will naturally correct and normal growth will happen thereafter. Some tips on how to ditch the dummy. There are some things you can do before you start reducing dummy use in your child. And that is, take some pressure off yourself. Remind yourself that I haven't seen many adults that are still using a dummy. Many children will stop using the dummy all by themselves. Choose your timing. A period of change or stress for yourself or your child might not be the best time to decide to give up the dummy. And then talk to your child about giving up the dummy. You might just be surprised by their understanding. If they are old enough, you can discuss it with them and come to a solution yourselves. So when you have discussed this and you are ready, try the following ideas. Try using the dummy less for comforting during the day, maybe limit it to night times. If they're at school, limit use of the dummy, and the child will get used to not using the dummy all the time. Gradually limit the use, even at night when settling. So after you've now stopped using the dummy during the day, you can start limiting the dummy use in the evening. So maybe limit it to every second or every third evening. Your child will then get used to life without a dummy. Then set a time and date. Decide maybe a Christmas time or a birthday to stop using the dummy. Once your child has given the dummy away, replace the dummy with a soft toy or a toy. Celebrate the occasion. Maybe give them a gift, a reward, and then try not to turn back. Once this has happened, it's now a good occasion. Sometimes you might go through a little bit of a hard time, or maybe not. Maybe 3-year-old child might start crying. Try and push through once we've done this. However, do not force this. If the child isn't ready for this and it is forced, your child might replace the dummy with a finger or a thumb. And that can be a lot more difficult to stop the habit. So if a child isn't completely ready, maybe give it another month or another 2 months, and then decide to start again and start talking to your child to limit the use of the dummy. So as with the prolonged use of a dummy, a prolonged use of prolonged finger sucking also has the same effects as you will have when using with prolonged use of a dummy. So the same thing, the open bite in the front, the narrower palate, the posterior teeth or the back teeth not biting correctly over each other, which leads to orthodontic problems, etc., etc. So with finger sucking, once again, you do not want a prolonged use of that. So now, once again, how to stop finger sucking. It is important, and I think this is the most important part to take away from here. Positive reinforcement is always better when trying to stop your child from finger sucking. So more do's rather than don'ts. Limit the time that your child sucks a finger by reminding them to not do it in public, for instance, or maybe that they only do it at nighttime or during bedtime. Don't turn it into a confrontation. Don't tell your child, you cannot suck your thumb anymore, or this is a bad thing. That might lead to a rebellion in your child, and then not working together with you. Have a conversation with your child. Sit down and talk to them and try and make them understand why sucking their thumb all the time is not a good thing. And they might eventually come to you and say, Mommy, I don't want to do this anymore. Will you help me? And then you've empowered your child to get there almost by themselves. Don't prohibit your child and traumatize your child, or not letting them go somewhere. Now they suck their thumb, you're going to punish them by not taking them to the movies or taking away something, as this will also create a rebellion. Practice self-awareness. When your child is sucking their thumb, ask them, do you know that you are sucking your thumb? Often they are not aware that they are sucking the thumb or sucking the finger. It's almost a reflex, it's a habit. So try and make them more aware, and they might become more aware as they do it, or remind them. They might often stop on their own. Be careful of dipping the finger in something nasty tasting or putting a Band-Aid on the finger. This can often lead to other problems, or chewing on a plaster on the finger. It's also not always very successful. So rather than that, try and come up with a creative way of doing it. So where a child is maybe an Elsa fan or a Bob the Builder fan, ask them, you ever see Elsa sucking the thumb? Especially if they have a role model. Use that as a positive reinforcement method. And then remember that a child will grow out of this. So assisting and aiding them, and it is important that we do that. It's not best left alone, but with positive reinforcement and so forth, this habit can be stopped. If not, there are always ways in which we as dentists can intervene using orthodontic appliances. So please consult with your dentist. It's always important to see a dentist regularly. This is what we do. We can help and advise in reinforcement methods, etc. And then if the habit isn't stopped and it's becoming an orthodontic problem, then we will intervene through orthodontic methods by using an appliance in the mouth that prevents the finger from going into the mouth. But this is always a last resort. It's always better to try and do it in a positive manner and together with a child. And if all else fails, we are here to support you and help in this. Thank you so much for tuning in tonight. It is absolutely wonderful. It's wonderful to have been able to talk with you. And on behalf of SADA, I would like to thank you for giving us the opportunity to share some of our knowledge with the general public.
Thank you, Dr. Polson. We appreciate your time.